Let me take this further by asking you, Doctor, you've been in this field for years now. How have you seen the refractive technology evolve over the last few years?
So I think refractive technology has evolved tremendously over the last few decades. Like I said, first we were using a knife like maybe 40 years ago. That era is completely over. We have now moved to the use of lasers. Now, when it comes to laser refractive surgery, we must understand that for anything to be permanent, it has to be done in a part of the cornea which is inert, because it should not respond back and reverse the change. I often give my patients an example that you sometimes have those paste-on tattoos, right? You paste it on your skin and then you wash your hands and that's gone. But when you have to really get a tattoo, it has to be embedded. The pigment has to be embedded a little deeper. Because the deeper the pigment, the response in terms of the healing back is not there, and it stays in a place where the change is permanent. Right? So what we do for laser refractive surgery is that we reshape the cornea. The cornea is the front focusing part of the eye. So like you need to wear spectacles, you need to create a change of equivalent to the spectacle power in the cornea. In order to create a permanent change, you have to make this change in the deeper part of the cornea. So the technology has evolved in a manner of how to access this middle part of the cornea, which we call the stroma. The first procedure that is very popularly addressed to as Lasik today requires a flap to be lifted in the cornea. Now, once this flap is lifted, you automatically have access to deeper tissue. Here, the excimer laser acts and within a matter of seconds reshapes this tissue. The amount of reshaping that is done depends on the spectacle power that you wear. And this flap is simply put back on. The cornea stroma naturally attracts the flap back into position and it holds it back into position. The only flip side is that this flap is a cut that with significant trauma it can dislodge, and it is a slight defect that remains with you forever. Under normal circumstances there is no issue with that, but still there can be a better way to do refractive surgery, and that came to the forefront nearly a decade ago with the technology called SMILE. And the latest advance on this technology is now the upgraded version called Silk. What we do in a SMILE or a Silk procedure is that instead of it being flap-based, we call it Lenticule-Based. We are now using a different laser, a more advanced laser. In Lasik, while we use the excimer laser, in SMILE or Silk or Lenticule-based surgeries, we use a femtosecond laser. A femtosecond laser has the ability to cut beneath the surface without the surface needing to be exposed. So what it does is, it basically doesn't require you to create a large flap to give it access to the cornea. It is able to work within the cornea without the cornea being exposed. So it basically carves out the lens that you need to remove. Right? Because if you remove tissue, you reshape the cornea. You can't add natural tissue like you add a spectacle or a contact lens, but you can remove the opposite of that shape to reshape the cornea. Right? So we are creating a shape in the cornea that when it is removed, the cornea is reshaped. The lenticule that is carved, like suppose the femtosecond laser is going to act beneath the surface without the cornea or the eye being opened up. Right? And then you simply make a very tiny 2 mm incision, which is 2 millimeter is something like 2 or 3 hair thickness. And then simply through that tiny incision, you remove the lenticule that the laser has carved out. And that is it. And because this incision is so tiny that it is covered by the lid, you can't even see it well the next day. And sometimes doctors that see a patient, even eye doctors, can't really tell on a general eye examination that the surgery has ever been performed. So this lenticule extraction procedure makes the surgery much more stable, precise. There is no danger of any defect remaining in the eye. And because you're not cutting much, the downtime in terms of getting some degree of dryness or taking some degree of extra care, like you can't go for a swim, etc. So sometimes when a patient gets a lenticular extraction surgery, we tell them that even if we don't see you after a couple of days for the rest of your life and you want to actually box with an opponent in a boxing match, that is the strength that we impart in terms of we're not taking away strength and giving you natural vision and a cornea which has natural strength enough to withstand any trauma.
Right.
Follow Planet Lasik and post your queries to get answers from the experts.